Good morning. I have with me today the founders of Everwell, Andrew Cross and Nakul Gupta. Andrew and Nakul, we are so pleased to have you and have Microsoft and Accenture partner with Everwell as a part of Project Amplify. Andrew, my first question goes to you. You have come a long way from home to be here to create technology solutions for some of the deadliest diseases that India and rest of the world faces. Tell us more about what made you take this bold step.
Thanks, Lathika, and thanks again for inviting us to be here. We're really excited to be here. I think what really defines myself and everyone at Everwell is that our excitement to work on some of the most challenging problems in global health and to use technology where appropriate to help address those challenges. So I think that's always been the motivation, is to kind of find environments that have these challenging problems, understand them deeply through partnerships with hospitals, with governments, with disease experts, and to bring our technology background to really address those challenges. So that for me, that started in 2011, actually, when I was working at Microsoft Research and had the opportunity to join the Bangalore lab. And while at that time we were looking at a broad set of ways that technology could address challenges, from education to agriculture to ultimately healthcare. And that's ultimately how Everwell got started, was through some partnerships in healthcare where we focused in on tuberculosis. Since those days, we've expanded beyond TB to look at things like HIV, mental health, maternal and child health, and even COVID. But that's really how the journey got started.
Fantastic. Nakul, tell us more about your role at Everwell. You started with Microsoft Research and decided to kind of spin off and start Everwell. So tell us more about your journey.
Thanks, Lathika. So like Andrew said, I think both Andrew, me and Will had met during our time in Microsoft Research. And we were working in a group for technology for emerging markets, where we were looking at healthcare solutions in healthcare, education, and so on. I think one such project was quite exciting, which was 99 Dots, which was basically an adherence innovation for multiple diseases. We tried it out for tuberculosis and then decided to spin off a separate organization to support the scale up of such innovations, like 99 Dots, but also broader infrastructural development for public health. So since then, I think we have grown our team exponentially since 2014-15. I've been involved since the beginning. I think my role today is spread across multiple areas. I look after engineering, product development, some of the India projects which we have ongoing, which includes an Nikshay work for platform management for tuberculosis in India, and multiple other operational aspects of the company. So yeah, I think both Andrew and I are spread across multiple different ways.
No, that's part of being a founder, right? Any and every role that is required, you kind of step in and do it. Andrew, tell us more about the work that you're doing around tuberculosis. If you could, specifically give us some of the areas where 99 Dots has really, helped in terms of adherence, that would be great.
Sure, absolutely. Maybe firstly, I'll kind of talk about the broad work that Everwell does, and then maybe spend a few minutes talking about 99 Dots. But very broadly, Everwell designs, develops, and deploys software systems, platforms to digitize what's called the cascade of care, or the patient experience with a public health disease. So for example, you might start with a population that needs to be aware of a disease. You might need to learn about the symptoms for TB, or maybe COVID is a very relevant example. So we support some of that awareness campaigns. Then you have a population of people that have symptoms who need to approach a doctor, get diagnoses. So again, we digitize that process for getting a diagnostic result. And then beyond diagnostics, you'll have those that are on treatment. You'll have prescriptions. You'll have refills. You'll have care from a counselor, support from a doctor. You might have financial support for things like TB from governments. So there's all these different steps in this journey, and for something like TB, where the ultimate goal is to be recurrence-free survival, then there is this kind of stage-wise journey, and we again digitize that and build out the workflows to help help people go through this process. So again, it's very focused on supporting someone undergoing treatment to recover using technology. So I think with that context, I'll zoom in on one aspect of care. So when a patient or when a person undergoing treatment has received a correct diagnosis, is now on TB, or again could be another disease, and has been given medications, there is a challenge with being able to complete that treatment. Even when drugs are freely available from the government and are highly effective, or freely available from any kind of system, there's still challenges taking that medication every single day for a long duration and completing treatment. There's lots of issues with just understanding treatment. There's lots of stigma around these treatments, traveling to a center for refills. So there, while there's lots of things in their favor, there's lots of things that make it challenging to complete these treatments. So that's where innovations like 99 Dots come in, to be able to understand where a patient is in their treatment, to remind them about their medication, to encourage them to understand when they might have missed a dose, and therefore to focus limited resources for counselors to support someone undergoing treatment. So in all of this, the technology is kind of an amplifier, in the spirit of this project as well, an amplifier to the human effort. There are doctors, there are healthcare workers that spend their entire time and are at risk themselves supporting these patients. The technology is really meant to amplify their efforts. It doesn't ever replace the human, but it just amplifies what they're already doing on the ground. So that's kind of our approach, and that's what 99 Dots is. And I think just to dive in a little more, 99 Dots is basically a call-based system. So when someone receives medication, it's wrapped in a basic envelope. So when they dispense their medication, they see a toll-free number, a hidden number behind that flap. So every time they take a medication, they can send a free call or a missed call to that number. So when that call goes through, there's no call center, it's a digital line. So healthcare workers can review these call logs, and we can have some automated reminders or escalations or human-based escalations as well when someone does not call. So that's, again, how 99 Dots works.
Ever since I was introduced to the technology a couple of years ago, I've been fascinated by something as simple as what you all have developed, but as important and critical. And that was one of the reasons why, we wanted you to work with us in terms of mental health. Nakul, the question to you is that, as a part of Amplify, you worked in terms of extending the work that you did for the TB patients and HIV patients to mental health. What has this collaboration been, and if you could tell us a little bit more about that?
Sure, thanks, Lathika. So I think our association with Microsoft goes back to since the time both Andrew and I were in Microsoft. I think a lot of our thinking, a lot of our mindsets have been shaped by our time in Microsoft research. So I think whether that's the approach in solving large impactful problems, having a research mindset, or focusing on data impact, data-driven impact, I think these are values which we cherish and wish to build upon, which were gained during the Microsoft tenure. So I think the relationship with Microsoft has always been strong. The way I view it is that Project Amplify is just an extension of that relationship. I think we are now partnered with Microsoft in a different dimension. We are able to leverage Microsoft's capacity to support startups and support scale up of smaller interventions. So I think with Project Amplify, I think we benefited immensely from mentorship and from technical expertise of Microsoft, and also infrastructure support by means of Azure Cloud and so on. I think the partnership also helped us try out a new avenue. So we deployed this technology solutions we had built in mental health. So I think the partnerships which Microsoft helped inculcate were instrumental in that. So it's been pretty productive and pretty effective. And I think we are quite grateful to have this partnership going.
Great. Last questions, to you, Nakul and Andrew. So Nakul, you've been doing this now for several years. Where do you see the potential? I think, in the 99 dots, what you have accomplished is phenomenal, but it's still probably a dot in the entire universe of care. So where do you see the opportunity in terms of for Everwell, in terms of providing this monitoring and adherence to medical care?
Sure. So I think, like Andrew described before, I think 99 dots, or the adherence piece, is a small portion of the work we do. So when we started 99 dots, we were excited about the potential impact in adherence. Gradually along the way, we realized that 99 dots is one portion of the puzzle, but there are other fundamental challenges which we can solve when using technology in public health. That's where we built the large-scale AOL Hub platform, and we tried sorting out different diseases, different components of the cascade of care. So I think over time, our understanding of the ecosystem has also increased. I think rather than focusing only on one small subset of a problem, we are focusing on the larger picture. And I think that picture continues to evolve and grow. So right now we are focused on across multiple diseases like tuberculosis, HIV, but we are also looking at larger interventions for national scale up in these diseases, expanding to other diseases, and making sure that public health becomes a top priority for technology innovators and technology companies. Because I think fundamentally my viewpoint is that public health is a space which has not been disrupted as much as by startups or by strong technological innovators. So I think bringing best-in-class engineering talent and best-in-class entrepreneurial talent to this space, I think will be a game changer. I think COVID has taught us that as well. So because of COVID,
For sure. I think
Yeah.
Right, digital adoption has gone down to all levels of society, which is really a fantastic opportunity, for social enterprises like yours. Andrew, my question to you is: do you see what is the opportunity for Everwell globally? This is probably not just a need that we have here in India. I know you've spent a
Mhm.
lot of time here in India. So, what do you see as the opportunity in terms of taking Everwell global?
Absolutely, and that's something we actually haven't talked about, yet today. But Everwell's mission really is to bring the highest quality care to the greatest number of people possible using our technology innovations. And what we've done in India, right now our platform is being used for the entire tuberculosis program. That's more than 2.5 million, new records, new patients every year coming onto the platform. That's 1/5 of the world's TB population. So we have, enormous impact here. But we've also got projects in about 14 other countries. So we've been able to take the innovations and kind of almost this incubation work that we've done, similar to the research work earlier, the new innovations we've developed here in India for TB, and as Nakul said, started to grow that. So we've grown geographically from just India to about 14 other countries, which have a lot of similarities, but a lot of differences as well. So a lot of our work is around contextualizing, adapting to new environments, and kind of the other dimension is also around disease states. So while again we started in TB, we've also been working in HIV, malaria, mental health, maternal and child health, and COVID more recently. So really expanding, kind of taking what we've learned, building on top of that, and then kind of expanding dimensions both geographically and disease states. And I think, maybe the last thing to say is, while we were working on this, previously, I think COVID really has brought global attention to, first of all, the challenges of public health and how interconnected our world is, but also the opportunity that technology can have, where it can and where it can't help. So I think, partially it is around connecting systems. Healthcare systems are notoriously disconnected where, the TB space and the HIV space not be connected. So I think we also see a huge opportunity for ourselves to help connect these different, so you have kind of holistic, better care for people. That's the ultimate goal, and connecting these different kind of disparate systems as much as we can using technology.
No, that's amazing. I didn't realize you were in 14 countries, but that's the power of technology, right? You can do, you don't have to be on the ground, and I think again, like Nakul mentioned, the pandemic has really helped in digital adoption. Andrew, Nakul, all the very best. We look forward to partnering closely with you through your journey over the next several years, and I'm sure you're going to really make a phenomenal impact as far as healthcare is concerned. Good luck and thank you again.